Public health units in the three largest cities in Canada have all come out in favor of the federal government decriminalizing the possession of small amounts of illegal drugs. And they're not the only ones. What's the thinking behind this move? Let's find out from Dr. Eileen de Villa, Medical Officer of Health for the City of Toronto. Welcome back.
Thank you for having me once again.
Toronto's Board of Health recently voted in favor of decriminalizing small amounts of illegal drugs. How come?
Well, I think that it was in response to a recommendation that we at Toronto Public Health put in front of the board, and it is out of a recognition that we are seeing significant health impacts in a very negative way on our population as a result of what can only be described as a drug poisoning crisis that's happening at this point in time. It's not new. It is something that predated the pandemic, but in fact has become worse and has been exacerbated by the conditions of the pandemic itself. So this was out of recognition that, the current methodology, the current approach to drugs and people who use drugs just simply isn't working. We are seeking as a public health department to optimize health, to maximize health for all in our city, and in particular to do so by reducing disparities in health. And the reality is that for people who use drugs, their situation has gotten worse, and that has actually been a negative impact on overall health of the city as the result. And we know that looking at the evidence that's out there, that decriminalization, changing our approach to drugs, is an important component of actually improving the health of people who use drugs and, frankly, our entire community as a whole.
You mentioned that you're speaking from a public health point of view. Why should this be considered a Why should this be considered a health problem and not a question of crime?
Well, I think we've seen that the current approach to drug use and people who use drugs in particular has maximized or magnified stigma and discrimination. And this in turn has actually been a negative impact, had an overall detrimental impact on the health of people who use drugs and, frankly, the entire community. Hence, what we're advocating for is an approach that actually treats this as a health issue, because it is a health issue. It is more than that as well. Clearly, health is not just a strictly health care managed proposition. There are many other components to this, which we call the social determinants of health. Things like housing and connectedness. These are things that are critical to the experience of health overall. But we know that the stigma and the stigmatization that's associated with the current approach to drugs, which criminalizes drug use and people who use drugs, really does take away from their health and actually takes away from the health of the entire community as a whole.
What types of drugs would we exempt?
So at this point in time, in contemplating the model that Toronto Public Health put forward for consideration by Health Canada, it does consider all drugs. There is much more conversation that clearly we need to have with our partners at Health Canada if an exemption is to be provided to allow for a change in approach, to remove criminal penalties for the possession of small amounts of drugs for personal use. That actually has to happen through Health Canada. What we've put forward to them is that our model contemplates all drugs. And we recognize that there are more conversations that have yet to be had with Health Canada partners before this can actually happen. But we're looking forward to those conversations so that we can actually change health for those who use drugs and for our entire community.
I know you said that the conversations are ongoing, but there's a lot of questions on what this would mean. How and who would determine what is a small amount?
So this is an issue that, as you could well imagine, has a lot of different opinions related to it. This is one subject on which we actually propose an ongoing work group both of concerned stakeholders, people who use drugs, healthcare providers, law enforcement, and others, along with discussions with Health Canada to actually land what makes the most sense in order to support overall community health. Again, I can't emphasize enough that the goal here is to optimize health for everybody, both people who use drugs and for the communities and their around them, which includes their friends and families. So I think that this is the kind of thing that does require more conversation with all the relevant stakeholders, so we come up with a model that truly works for our circumstances here in Toronto, and notably for the people of Toronto.
I know you said that you want to engage all stakeholders, but we do live in a society where, I still remember that I think it was grade three when we did. Someone was teaching us not to do drugs, and they had an egg and they put it in a pan. This is your brain. This is your brain on drugs. And I'm assuming that the broader public. At large would have to buy into this. So is education a component of this?
Yes, I would say that education is an important component of virtually every public health intervention. But Nam, I think it's really worth pointing out that the conversation around drugs has changed significantly in our society. I think there's an increasing understanding that this is an important health issue, and it's one that should be dealt then as such, rather than treating it as a criminal issue. And in fact, the kind of conversation that we're having right now simply wouldn't have been possible as recently as just a few years ago. I note that, for example, the Canadian Association of Chiefs of Police, the Ontario Association of Chiefs of Police, have spoken in favor of, managing drug use as a health issue more so than as a criminal issue, and really have put forth support for decriminalization. Ontario's big city mayors have also expressed their support for this kind of action, recognizing that we are talking about a health issue, what is fundamentally a health issue. So I think that there is an openness, there's an increasing understanding, and especially with what we've been through for the past 2 years with the pandemic, I think there is a unique sensitivity and an even more developed understanding of how significant this is and why we need to take this type of public health approach that really puts the focus on people and what really drives their health.
And I guess also immediacy. What's the timeline like for this getting approved by the federal government?
Well, Nam, that might actually be a question better posed to our federal government partners, as this really is in their responsibility. But I can tell you that we're very keen to work with them to make sure that we're addressing any questions that they may have. And of course, we're keen to make sure that we're doing the best that we can by the stakeholders who've participated in the process thus far, and those who will benefit, I think, from this kind of approach and this different way of looking at and actually approaching issues related to drug use.
You mentioned the opioid epidemic in Toronto. What's the situation like on the ground? How bad is it?
Well, I feel for so many people, we have lost far too many lives at their peak. These are people at the prime of their life, losing their lives to frankly what is a preventable cause, and we know it has been significant. I think about our situation here in Toronto, which of course, as I mentioned, predated the pandemic. But when we look at the most recent years for which we have data, when we look at 2020, we had 843 suspect drug-related overdoses, which was a 71% increase from the previous year. And looking specifically at deaths related to opioid toxicity in Toronto in 2020, that was 531 deaths, 80% increase from the previous year. And the tragedy is that these are preventable deaths. We have the knowledge, we have the power to do something different to save these lives and to optimize health. Yes, for people who use drugs, and yes, for the entire community. So, as the local public health unit, we of course take this responsibility very seriously. Hence, we have this application in front of our federal partners and are committed to working with them and with the relevant stakeholders to see this through.
You mentioned that it had the situation on the ground has become worse. How has the pandemic impacted the opioid crisis in the city?
Well, there's no question that, as I mentioned before, the stigmatization and the discrimination that comes as a result of using drugs is part and parcel of it. But I would say that looking at the measures that needed to take place and the kind of advice that people had to follow over the course of the pandemic in order to reduce the transmission of COVID-19, these certainly made the situation far more challenging on the ground. Things like isolating from each other meant that services like supervised consumption services and other harm reduction services were frankly less available, particularly during those peak times in the pandemic when there was a lot of COVID-19 activity and therefore an increasing amount of public health measures and restrictions. This certainly created more of a challenge for people who use drugs to get access to the necessary services and harm reduction supports to help them keep themselves safe. So that was certainly part of it. Add to that an incredibly toxic drug supply that's out there in the public, and you put these two things together, and it was a terrible combination. Hence, I think we saw the kinds of numbers that we saw in 2020 and straight into 2021 as well. The data for that year are still being tallied at this point in time. But I have to emphasize now, we know from evidence and we know from the experience of other jurisdictions that there are things that we can do, of which decriminalization is one. If we add decriminalization to other measures to support better access to health and social supports, things like housing, supportive housing in particular, we know that we can make a difference and save lives and make for a healthier city overall.
Safe supply has been a part of this conversation when we talk about decriminalizing small amounts of drugs, of illegal drugs. And I wanted to read you something by Gillian Cola and Carol Strike of the Dalalana School of Public Health at the University of Toronto, writing in the Harm Reduction Journal. They write, research examining drug selling has found that it is a common income generation strategy among people who inject drugs, particularly among people who report daily drug use. When examining the relationship between people who use drugs and people who sell drugs, people who use drugs often describe high levels of trust when buying from their regular drug seller and consider a long and trusted relationship with the person selling them drugs as a source of protection against overdose. Given the overlap between the people selling and the drug using, do we need to reapproach? Do we need to rethink our approach to people who sell drugs as well?
Nam, I think that's a very involved and complex question. And I would say this that you could see how relationships develop between people over time. I think that's a very natural human experience. The challenge, I think, of course, for many sellers of drugs out there in on the streets and in our communities is that they may be far down the chain and may not know exactly what they're getting in their product. That's what we've noted. There are times where we have particularly toxic drugs and toxic combinations of drugs that are out there on the street. This often gives rise to series of overdose incidents, some of which unfortunately turn out to be fatal. I do think that we need to keep an open mind, though, which is, I think, what the researchers were getting at here. There's an opportunity for us to approach this with less of a stigmatized attitude, focused on how do we actually make connections with people who use drugs so that they are afforded the opportunities to experience better health overall. And better health is, yes, part and parcel related to drug use, but also is related to the many other social determinants of health that actually underpin an individual and a community's experience of health. As I mentioned, housing, connectedness, a sense of belonging, a sense of purpose. These are all important parts of experiencing optimal health and should be part and parcel of an approach that focuses on health, social supports, and just overall well being.
Because we don't know when this will happen, when these drugs will be decriminalized. Are there any other harm reduction strategies that the city is exploring?
Yes, absolutely. We're constantly working with partners out in the community to make sure that we're putting out services and providing supports that are in keeping with the best available evidence, and of course, for which we have resources. So, over the course of the pandemic, in partnership with a number of different colleagues, we've opened urgent public health need sites to allow for supervised consumption of drugs so as to protect people from overdose. We are in partnership with a number of other healthcare providers, notably our colleagues at South Riverdale Community Health Center and Parkdale Queen West Community Health Center on a provision of different kinds of hydromorphone, for example, and injectable opioid agonist therapies in order to, one, protect the people who are using them, and two, to study the impact to consider whether these are different strategies that can help protect lives and improve health overall. We're using technologies and testing out technologies to see what we can do about alerting people when they're using drugs or when we suspect there may be an overdose. There's all kinds of things that we're doing in partnership with other healthcare providers and with people who use drugs to make sure that we're doing the best we can to prevent the loss of life and ultimately to protect and promote health.
We have about 30 seconds left, and you said that the conversation around drugs has changed a lot in the past few decades. If this were approved, would it make Toronto a more attractive market to sell and consume drugs?
You know, I think that there is that possibility that exists, but I think that the benefits of having, stronger, healthier communities that are characterized by less stigma and discrimination will counter that. I think it's important that we think about all the consequences of the different decisions that are taken, but really are focused on overall health and what we can do as based on the evidence to improve that. That's been the experience of other jurisdictions that have taken this step, that they are actually seeing better outcomes as a result of having moved towards decriminalization. And I would hope that we will have the opportunity to enjoy the same benefits here in Toronto.
Dr. de Villa, thank you so much for your time, and thank you for all the hard work that you've been doing throughout this pandemic. We really do appreciate you making time for us tonight. Thank you.
Thank you, Nam.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.